I'm here because I work for a company, MSD, who in 2011 made the commitment that no woman should have to die while giving life. And so when we come back here next year, 5 years from now, 10 years from now, when our children come back and have this conference, we will not see the same numbers of folks who stood up, standing up at that time. We saw also on the film that you showed, Dr. Asagi at Luth. I was born at Luth. But when I decided to have my children, I decided not to have them in this country because I did not want to be a statistic. But because of all of you in this room and their standing room only, my hope is that for my 2 daughters, if they're going to make the decision of where to have birth, that Nigeria would be a place that they would consider because they would not have to fear dying while giving life. I also want to tell you another story. This happened in my in-laws' family. A member of their family, during the baby shower, swollen legs, swollen face. A lot of her family commented on how swollen she was. But she mentioned, she had gone to the doctor that week. Doctor had not said anything was wrong. She had gotten tests. And that she also had another doctor's appointment the following week to check up. And again, nothing was shared with her, or at least shared with her in a way that she understood things that she should do to take care of herself. She walked into a hospital, but she didn't walk out. Now, all the people who have stood up have had that experience. But that experience did not happen in Nigeria. That experience actually happened in the United States. And I share it because this issue of maternal mortality and that the quality that we need to prevent women from dying is not just an issue for low-resource settings. It's an issue across the globe. And if we don't focus on those foundations of quality and make those foundations strong, they can erode. The United States is the only developed country that has seen reductions in maternal mortality in the past 20, 25 years. In fact, maternal mortality rates have increased by over 50% since the year 2000. This is unacceptable, but if we don't keep the pressure on, this is something that can happen and can happen here in Nigeria as well. We already see from the latest statistics from WHO that rates are rising. You know, Nigerians like to be number one in everything. Is that not so? But we should not be number one in maternal mortality. And the unfortunate truth is we are. We contribute to 23% of the deaths globally on this issue. And I know that we can all do better. And I know all of you here are working to change that statistic. And the reason I know that we can do better is because we have seen amazing results right here in this country. Earlier this year, teams in Cross River State, Group Pathfinder, reported that they had reduced maternal mortality rates by 66% in 3 years throughout the state. Now, because of the work that they did, 90% of women in that state are less than 2 hours from high-quality emergency obstetric services. How did they make that happen? By working with all of you and by working with the communities and pulling on community assets and community resources. They worked with the traditional birth attendants to include them in the solutions. Work with, teach, educate, inform, support mothers in their villages, and make sure that they were able to get the right care that they needed at the right time, and support them in getting that care. They also worked with all of the facilities, not just private facilities and not just public facilities, but both private and public, together, to improve quality of care, and to also ask themselves the tough questions. So when there was a death, they actually investigated it, and not to assign blame, but to figure out what went wrong so that they could prevent the next death. And because of processes like that, we saw that 66% reduction. Cross River State is one of 36. We need to replicate those results across the nation. We've heard from our distinguished speakers today all of the different things that need to happen for those types of results to be sustained. We need national leadership, policies. We need local leadership and champions to actually make it happen on the ground. We need institutions and structures like accreditation systems that will actually recognize, reward, and value all of you that are investing in quality improvement. Because if the person on the street doesn't know when they're entering a clinic that this is a high-quality facility, they are going to be spending their hard-earned naira on something that is not going to make them better, and in fact, may kill them. And so, what I want to end with is that you actually don't need to read book, to understand what quality is. We can just ask any of us. And in fact, when a group called White Ribbon Alliance asked thousands of women in Nigeria, the top two things that they said that they needed for quality was water and sanitation and respect. So, you don't need a degree. You don't need extra training to be respectful to our mothers, our sisters, our daughters, our friends who are entering all of our healthcare facilities and giving birth. But what we do need to recognize is that there are many reasons why a maternal death that happens. And so the solutions have to be multifactorial. But the good news about that is, because the solutions are multifactorial, each and every one of us has a role to play. Whether you're an Okada driver, getting a pregnant woman to the clinic on time, whether you're a physician, whether you're a drug manufacturer, whether you're a nurse, all of us have a role to play. And one woman at a time, we can end maternal mortality. I'd like to end by thanking all the MSD for Mothers partners in the room. I've lived vicariously through all the work that you have been doing on social media, really, literally going to the last mile to figure out what it is women and communities want and need in order to reduce maternal mortality. I've been inspired by that energy, that passion, that commitment that I've seen. And so I believe with that energy that we all know Nigerians have, that social entrepreneurship, that progress, that we will be able to create a world where no woman has to die. Thank you.